All right. Alicia, do you want to start?
Hi everybody, I'm Alicia Romano. For those of you who do not know me, I'm the Director of Community Health at Allies for Health and Wellbeing. We're located over in East Liberty. Allies is the oldest HIV/AIDS service provider in Western Pennsylvania. We started in 1985 as the Pittsburgh AIDS Task Force, and then rebranded to Allies for Health and Wellbeing about 5 years ago. And the reason for that was just because of an expansion of services, really. Allies always has and always will specialize in HIV treatment and prevention. We also, the three main bullet points of services that we offer are community health, outreach, testing, and education. So my department does all of our free on-site HIV, STI, Hep C testing, rapid testing, as well as our community outreach testing. We have a mobile testing unit that goes out into the community a few times a week in various locations to offer free testing. We also have an educational program where we go into, COVID sort of, put a damper on it, but we're starting to get back into the high school settings, in the college and university settings, where we're offering educational sessions on HIV 101, just STI safety in general. We talk a lot about healthy relationships, consent, things like that. So we have outreach and education, which includes our free testing. We also case manage folks who are living with HIV. We have about 600 plus individuals who are living with HIV who are in our who are case managed by us. We offer through that pro bono legal services. We have a food pantry on site. We also offer financial assistance, housing assistance, things like that. So in conjunction with the community outreach, the case management, we also have on-site clinic or primary care services. And with that, we treat HIV, we offer PrEP, PEP, we treat hepatitis C. We also do gynecological care, hormone replacement therapy. We also last year, about a year and a half ago, maybe at this point, started an MAT program where we are treating folks with addiction. We have behavioral health services on site, primarily for our folks who are living with HIV, but that I feel program has expanded greatly in the past year and a half or so. So that's sort of the main factors of what we do. And that's me. I've been with the agency for about 4 years. I've been in community health for over a decade. So I'm happy to be here today.
Thank you. Christine, you want to go next?
Sure, thank you. Hi, everyone. I'm Christine Gordon. I am the VP for Education at Planned Parenthood of Western Pennsylvania. And I've been there about 4 years as well. Alicia and I overlapped just briefly in her former life. And let's see, Planned Parenthood of Western Pennsylvania offers sexual and reproductive healthcare services, a wide variety of services, really. We provide clinics family planning clinics that include all kinds of healthcare, including HIV and other STI testing, birth control, all of the things that you would expect, gynecological exams, breast exams, all of that stuff. We also offer abortions at our downtown clinic, abortion services clinic. And we offer education programming throughout Western Pennsylvania, mostly around Pittsburgh, in and around Pittsburgh, for youth and adults. We have a peer education program that's almost 30 years old that has been in schools and educating young people to be peer educators for almost 30 years now. And we also have community education, and we have a drop-in center in Hazelwood, which also COVID has been a little bit hard on, but we're working towards reopening that soon. So we provide a lot of things. Most of the things that Alicia was talking about, though we don't emphasize HIV and we don't do HIV case management, we refer out to the other great organizations in the area, but we do provide free testing. and low-cost testing in our clinics, sometimes free testing at other events in the community as well. Then we work, for people who have a reactive result to an HIV test, we work closely to link them to care at a place like Allies or some of the other great places in the area. And of course, we do a lot of education and risk reduction counseling through our work and with our small department. So very happy to be here today. Thank you.
Thank you for being here. Tyrell, you want to take it?
Well, hi, my name is Tyrone. I am a community health specialist down at Project Silk, where we specialize in sexual and mental health and a slew of a bunch of other services pertaining to testing and different types of linkage to care. We do this for the LGBTQIA POC youth and allies. We also provide extracurricular services that are more on the artsy side. We do music therapy, we do writing therapy, art therapy. We host events towards bring back our mission for sexual health. And I just happy to be here.
Thank you for being here. So I wanted to start out just to give a basic idea, just understand what exactly HIV is. And if somebody could answer what HIV is, and if you could explain about the difference between HIV and AIDS, that would be great. Whoever wants to take that one.
Yeah, I'm happy to field it. As far as HIV goes, it is a virus, and it can be contracted in one of 5 ways. HIV can be the virus can be contracted through blood, through semen, which includes pre-ejaculation, through vaginal fluid, through rectal fluid, as well as through breast milk. And what HIV does is it attacks the CD4 cells. So the CD4 cells are essentially the cells within our body that help to boost our immune system. So what HIV does is it enters our body and it attacks those CD4 cells, but it can't reproduce on its own. So what happens is the HIV cell basically penetrates those CD4 cells and it takes over the DNA of the CD4 cell, and it uses that DNA to reproduce itself and send out more HIV virus into the body. So essentially, HIV and AIDS are not necessarily the same thing. One leads to the other. Folks typically start out having HIV, and there are 3 stages to HIV. Once a person reaches that 3rd stage, which is AIDS, which stands for acquired immunodeficiency syndrome, that typically means that your CD4 cell count is below 200 units per cubic millimeter or something like that, which is 0.004 of a cup or something like that. It's a very, very small amount. So once a person's CD4 cells drop below 200, that's whenever they develop into AIDS, and they're really kind of toward end stages, at that point of the virus, after having gone through the 1st stage, which is the stage where people experience more flu-like symptoms, very, very highly contagious in the very 1st stages of HIV. And the reason being is because the virus is producing so rapidly. Once the person reaches the 2nd stage, or the latency stage, they can become asymptomatic. People can live in the latency stage for decades and decades upon decades. And the problem is that when people first contract HIV and they have those flu-like symptoms in that 1st stage, they don't necessarily know that they have HIV because it does really mimic the flu. You can feel really worn down and drained and feverish. So somebody's just thinking that they have the flu, meanwhile they have HIV. Then they move into that 2nd stage, which is the latency stage, and then their symptoms go away. They have no clue that they have HIV because now they're no longer experiencing symptoms, although not quite as contagious as in the first stage. Obviously, you can still contract HIV from person to person based on the 5 methods that I had mentioned earlier. And again, if you go untreated, your CD4 cell counts are going to continue to drop, in which case you'll end up in that 3rd stage, which is AIDS. And I think I answered your question, Abby.
Yeah, you did.
It's just what is HIV and what is AIDS? If there was any other part of that question that I made, just let me know.
No, I think that was great. You hit the different ways that it can be transmitted as well. And I just wanted to ask, who can be affected by HIV? Christine, you want to take that one?
Sure. Yeah. I mean, anybody can be affected by HIV. And so I think that's what's really important, because as humans, we all have immune systems. And if those immune systems are attacked and made less useful or capable, then that's what the issue is. You know, eventually, then we often get people can get what are called opportunistic infections, because normal germs that our bodies and our immune systems would fight off, we can no longer fight off. And so that's usually in the AIDS stage, so that later stage that Alicia was just talking about. But anybody who has a body can be affected by it. And of course, loved ones can be affected by it too. The primary ways that people do transmit, Alicia talked about the fluids that transmit HIV, and the primary methods or behaviors that transmit HIV are through sexual behavior, and primarily that's going to be vaginal or anal sex, and then also sharing needles for like home tattooing or injection drug use. Those are the primary methods by which we can contract HIV. So it can infect anybody who has sexual contact with another person, or anybody who shares needles with other people. And so it is really important. There's also a much less common, but it does happen sometimes, that it can be transmitted from a mother to a fetus in utero, or through breast milk after birth. But because the medications are so good now, that happens much less frequently as long as somebody is being treated.
And what are some of the things that we can be doing to help prevent the spread of HIV?
Well, for one, there's condoms, there's abstinence, there is PrEP, there is knowing your status, there is PEP. So, because if you are positive, you should start taking your medication, so you can, because U equals U, and that means undetectable means untransmittable. So if you are undetectable, that means you can't pass the virus onto another.
Can you talk a little bit more about PrEP and PEP and what that stands for and what it is?
Okay, so PrEP is a pill you take if you do not have HIV, if you have not contracted HIV. I don't know why I'm drawing a blank right now on what it stands for.
Do you want some help?
Yeah, everybody's staring at you, that's why.
We're all here to support. PrEP stands for pre-exposure prophylaxis, which just means before you're exposed to the virus, it's a preventative measure.
Yeah, and PrEP is, if taken as prescribed, it's 99% effective in folks who are engaging in sexual activity. And I think it's around 74, 75% effective for folks who engage in IV drug use.
Yeah, I think that's right. It's very, very effective and is a great thing for people to take who maybe at elevated risk for contracting HIV because of sexual behaviors or injection drug use behaviors that make you have a higher risk of potentially encountering the HIV virus. So it is a wonderful tool that we have and is available at a number of places around Pittsburgh. I think all three of our organizations offer it. And you can also go to AIDS Free Pittsburgh's website, which I can put the link in the chat later, but they have a whole list of places where you can go and get PrEP, where you can get tested, things like that. So I think those are great. Also, PEP, you mentioned, Tyrell, and that stands for post-exposure prophylaxis. That's most commonly used in cases where maybe there's been a sexual assault, and so a condom couldn't be used. Thank you, JT. Where a condom couldn't be used, so there's unprotected sex that's happened, or in cases of a needle stick, like an unintended needle stick, which is typically just in healthcare situations, and it's very rare. We have a lot of protections, but if it does happen, you can take this medication and it helps prevent the likelihood that you will contract the virus even if you are exposed to it.
And then what about, so we mentioned condoms also. So can we talk a little bit more about safer sex, what exactly safer sex is, and why it's important also?
I've been talking too much, so I want someone else to go ahead.
Well, safer sex is very important because, for one, if you are positive, it's a great way to not spread the virus. If it's a way to not do anything that I don't want to say regret, but regret. Even if you're not if you're young and you're promiscuous, you will benefit better from using a condom in a heterosexual relationship, so you won't there won't be any unexpected pregnancies, any other STIs. Sexually transmitted infections. Safer sex is good because, especially with condoms, because a lot of the stuff won't get passed through. You get what I mean?
Right. It's a barrier, right? So it prevents those body fluids that we were talking about from going from one person to another during intimate sexual contact. So I think it's really a wonderful tool. And as Tyrell was saying, like, can help prevent pregnancy for people with a uterus, and also can protect really well when used consistently and correctly. Condoms protect most people. I think typical use is like 92%. It is still very high, and perfect use is like 99%, but we are not perfect. We are all human, but I think it's a fabulous way to keep those fluids from mixing, which can prevent sexual transmission of HIV.
Yeah, that's a good point. You said consistently and correctly, Christine. That was a good point. I recognize a few names on the attendees list, but I don't know everyone, so I'm not sure what everyone's role is who is attending. But for anybody who is an educator, I think it's important also to, if you're somebody who has some sort of condom distribution program, to also include education around how to use a condom and not just assume that people just know, but kind of just giving a really brief description of, take it out of the package, pinch the tip of the condom, roll it down over the shaft of the penis, and as far as like even taking it off, like making sure that, the penis is still erect before taking the condom off. And there's just these little kind of nitty gritty details about how to put a condom on and off that you can really explain to someone in very few words. But kind of sending them off with that information. And even when people are like, oh, I know I've been using condoms, for 20 years, I know how to use them on. Oh, yeah. My response to that is, oh, yeah. Then you're supposed to like pinch the tip and roll it down over the shaft, and so there's enough room at the tip, whenever ejaculation occurs. And I just like literally just throw that in really, really quickly, just in case folks don't know, and we don't ever want to assume that people know even when they say they don't know. I mean, I think of my own personal self, I think of being in the kitchen, like with my mom cooking, and she's like, do you know how to do this thing? And I say, oh yeah, I know how to do that. I know how to do that. Don't tell me. It's the same concept. It's the same idea. Meanwhile, I've never done that thing in my life. I just don't want anybody to tell me what to do.
And to piggyback off of that, incidentally, at Project Silk, we do a sexual health type class where we do demonstrations like that.
Oh,
and if at any time that anybody who's watching, knows anyone who has or who doesn't know anything about it, we're like a great place to get those questions answered. So yeah.
Yeah, that's great. Thanks, Tyrone.
Yeah, absolutely. Absolutely. We all offer education services throughout the community, and please take advantage of us. You can contact us through our websites or whatever.
So we've talked about helping to prevent the spread of HIV. I think, Tyrell, you mentioned know your status. So I want to kind of transition into talking about getting tested for HIV. So I think we've answered it a little bit, but does anybody else want to talk about more about the importance of getting tested for HIV, about knowing your status? We've hit on it, so we can skip that one if there's no more to be said on that.
I'm happy to talk about it, but I
Okay.
also want to give Alicia a chance because I haven't.
Oh, no, that's okay. Yeah, I just think it's a matter of, what we tell folks out in the community is that, as with anything in life, we want to move forward with having the utmost information, just being as educated as we possibly can so that we can make as informed decisions as we possibly can. And knowing your status is a part of that. If you don't know your HIV status and you are very sexually active, you have multiple partners, you may proceed differently or with more semblance of caution with having the knowledge of your HIV status, and particularly if you happen to be positive. You may be more inclined to make different decisions. So yeah, it's just a matter of, again, with anything in life, we want to be able to make sure that we're making informed decisions for ourselves, but we have to be educated in order to do that.
Yeah, absolutely. Knowledge is power, I mean, it's trite, but it's so true. And another thing that I'll say is that Tyrell mentioned earlier, U equals U. So undetectable viral load in someone's body equals untransmissible. So you can't spread it to someone else. And the medications for treating HIV now are so very good. It has really changed the game on HIV. And so if you are someone who has HIV, you've gotten tested, you found out your status, and you're getting treatment, good treatment, then your viral load can, for a lot of people, get so low that you are not going to be able to transmit it to a partner. And that's important, but it has to be with treatment, with regular monitoring by a healthcare professional. And, that is also a game changer because a lot of people feel like when I started doing this work, which was a long time ago, people were like, oh, well, if I get HIV, I could never have like a long-term relationship or a partner or something like that. And that's not the reality. I mean, never really was the reality, but I understand why that stigma existed a little more. But now with the fantastic treatments that we have, that is really not the case at all. And there are a lot of ways that you and your partner can stay healthy and that someone who has HIV can keep from transmitting HIV to a long-term partner, any partner or partners that they have. So I really do believe that it is such an important thing. The other thing is, Alicia mentioned earlier how most people don't know when they get HIV because the symptoms are flu-like. And that's actually true with a lot of almost all STIs. Sexually transmitted infections have no symptoms for many, many people. And so getting tested regularly is the most important component of your sexual health once you are sexually active, like so that you know, so that you have that knowledge, because leaving things untreated for a long time, they're going to cause so much more trouble in your body, in your partner's bodies. You know, it's just a lot harder to deal with. When you catch things early, when you're getting tested regularly and taking precautions, then you're taking care of everyone in your community, really.
No, so incidentally, just to piggyback off of that, I was just in a dinner meeting with Gilead. Amazing time. Had an amazing time. We actually talked about you equals you and the stigma on that, because a lot of people didn't believe that it was true, that, you know, if you take your medicine, you know, consistently, that you know, you wouldn't be transmittable. So I just want to, you know, put out there that it's a fact that if you are undetectable, you are untransmittable, and what you said is very true.
And as far as numbers go, it's when you're undetectable when you have less than 50 copies of the virus per like 1 milliliter of blood. So it's very trackable.
How often would you say that you should be getting tested for HIV, for STIs in general? How often should you be getting tested?
As soon as 3 months, you know, every 3 months, or as soon as, like, you know, as soon as you feel like you've been at, you know, at risk, you know, just know your status as consistently as possible. Yeah.
Yeah, Tyrell hit it. Yeah, I mean, for somebody who's high risk, yeah, every 3 months, every 3 to 6 months at least. I mean, everybody should have, according to the CDC, everybody should have at least one HIV test in their lifetime. Folks who maybe are not as high of risk but are sexually active might get tested once a year, but Tyrell hit it. Like, if you're high risk, every 3 months is ideal.
Can I also take us again just to talk about the 3 month point? I was at an event last night and we started talking about the window period, which is what we call the period between when someone gets infected with HIV before a test can actually typically recognize it, right, and get those results. So that is something that it could for some people be, you know, like 6 weeks, but up to 3 months. And so that's why if you had a possible exposure, you're like, oh, I don't know that person's status, I didn't use a condom, or it broke or something like that, you don't want to go. I mean, you can go right after and get tested, but the chances of it capturing whether you had contracted HIV from that experience are almost none until you've let that time period go by. So you can get tested right away, but they should tell you, and you should go back and get tested again after 3 months, just to give your body time to develop the antibodies, which is what the tests, or the antigens, which is what the tests typically look for.
What can one expect when they go to get tested for HIV? What is the process like?
Okay, I know. Well, for me, I know that, like, no matter what, I'll try to meet them where they're at, and, you know, see what they're looking for first, and then it's always confidential. We just go sit in the room. I start talking to them first before I administer, you know, the test. That way, you won't feel uncomfortable with me either pricking your finger or drawing blood from you. I just continue like a conversation. I ask a bunch of questions just so we can like get a rapport going. Again, I just meet you where you're at, and I see what you're comfortable with as far as which test would you like, mouth swabs, finger pricks, anything like that. We fill out some paperwork, just to I can get your information. It's just so I know how to contact you if, if there is any activity, um, you know, and then we'll just administer the test and wait, the time period, or, depending on what the situation is, sometimes, people might have to go, and I'll work out a way to give somebody the results. Usually I don't like to do it over the phone. I don't think that's even allowed for referral, but I try to still meet them where they're at, because sometimes you can, like, um, that's what they would prefer, to hear it like that. So I just, again, just I'm just right here with them. Like, whatever you need, just let me know. And then that's it. And then people just, I guess, learn to, trust their counselors that way.
At Allies, we offer both appointments and walk-ins 6 days a week. Every day but Saturday. We're closed on Saturdays. But we do, and then the Wednesdays and Thursdays we have evening hours. We actually test until 8 on Wednesdays and Thursdays. And we're also out in the community, like I said, at various intervals. We spend most of our time is spent in the Mon Valley. We're starting to dip into Uptown a little bit. We're working with Uptown partners, doing mobile testing as well. But like Tyrone said, somebody comes in, whether it's for an appointment or walk-in, we do all rapid testing, except for gonorrhea and chlamydia. We do we take a urine sample, and that takes 3 to 5 days for results to come back in. But everything else is a rapid test. For hepatitis C, for syphilis, and for HIV, it's all a rapid test. So we can offer results within 15 to 20 minutes, depending on which test they get. It's just a prick of the finger. People are typically, by the time they come in, check in, register, go through social sexual history stuff, run the actual test. We do a risk reduction with everybody while we're waiting for those results. We'll ask a series of questions that are more risk reduction related, provide the result. It's typically about a 25-minute visit, I would say, from start to finish for us. Yeah, and the nice setup for Allies is that we have the clinic right across the hall. So if someone should test, be symptomatic for gonorrhea or chlamydia, or have symptoms for gonorrhea or chlamydia, or be symptomatic for maybe syphilis, or test reactive for HIV, we have a rapid protocol in place where we can just send folks right across the hall for immediate treatment. So if someone comes into the office, tests reactive, they're going to leave with medications that same day. And spending time in the Mon Valley has been really great, working with the folks at Louderman Clinic. We test outside the 9th Street Clinic. 1 day a month we're down there. We're also outside of Montauk in the Keysport 1 day a month. And it's really nice to be able to, we have a workflow in place with the 9th Street Clinic where we have contact, kind of a warm handoff to them for folks who test reactive too. So that's been really convenient as well. And they're really easy to work with as well.
That's great.
But having like Silk and Planned Parenthood downtown is a big deal, because transportation in Pittsburgh can be a real nightmare, particularly if you live in the South Hills. If you live in the Mon Valley, forget about it. So, but every bus goes to downtown Pittsburgh. So, I mean, having Project Silk and having Planned Parenthood downtown, particularly for folks who need PrEP in a pinch and they can't get to East Liberty or they can't get anywhere else, is really, really convenient for us. So thank you.
Oh, that's great. That's great. At Planned Parenthood, we do rapid tests and non-rapid long tests. I don't know, full blood draws that will be sent out and take some time at our clinics. And we also are currently offering free at-home test kits, which is a pretty new offering. You can now get HIV tests over the counter in many drugstores, and we have, through funding, AIDS Free Pittsburgh, yay, AIDS Free Pittsburgh, have gotten a number of those that we are able to give out for free. So that's something that we're offering currently as well, which is a great possibility. You know, it's so nice to be able to be with someone and talk to them, give them the results, really help guide them to rapid linkage to care. But that can also be a barrier for some people, you know, coming into a medical provider's office. Maybe they don't trust medical providers, or, you know, lots of reasons, or the timing doesn't work or something like that. So, and that one is an oral swab, which people who have a big fear of needles also, you know, that could be a better option as well.
Yeah. Like I said before, like, you know, meeting them where they're at, like even if we have to stick with them all the way through, because like you said, sometimes they don't trust them. But like I'll keep the report open to where I'll try to like get them trusting enough to where like if they need support, then when they go to their meetings or their appointments, that I will go with them, or I will walk with them to the clinics, or to over to like central outreach, because that's what we used to do. We would walk them straight across the bridge or something like that. Or just like, you know, if they don't have time, make sure that they have information to other clinics and other hospitals where they can get their treatment and stuff. And we will also like make sure that they, you know, that their appointment is set up for them to at least go, and then we will do follow-ups and things like that.
So it sounds like if you do get a reactive test, that you are set up with resources, you're given resources right away, so you know what the next steps are, right? That's awesome. And then just kind of staying on this train of thought, I think all three of you have actually mentioned some of the barriers that people face when it comes to getting tested for HIV. Were there any other barriers that exist? I know stigma is a really big thing still. But could you all talk a little bit more about what other barriers might exist as well, besides the ones you've already mentioned? So we mentioned transportation and—
Yeah, I was going to say for us, the two biggest that we see are stigma and transportation. And the stigma comes from from what we see in the community, it's less about HIV and more about someone thinking that you're gay. You say HIV to somebody out in the community, and it's one of the first responses we get is, "Oh, I'm not gay. I don't do that. I don't need that." So then it's a process of trying to walk with folks down the sidewalk as they're trying to get away from you. Just to talk with them about who gets HIV and how you get it. And like Christine said, you know, anybody who's sexually active can get HIV, and just providing some of that education and reducing some of that stigma around HIV.
Yeah, consistent like reassurance is really important. Like, because sometimes it doesn't click. You know, when someone hears something like that, it doesn't click that like, okay, well, it can't be me because of of whatever stigma. But like just consistently say, well, you're not exempt. This virus doesn't see race, doesn't see color, doesn't see sex, doesn't see gender, doesn't see age. It can be for anyone.
Yeah, I like that. Yeah, I like how you put that.
Yeah, I agree. One of the areas that we've found is, well, I guess what I want to say is, like, when we work with young people, we find that there is already so much stigma really around all STIs. And that's one of the things that we're really working on, and even, working to try to start getting comprehensive sex ed to younger children, because by the time they're in middle school and high school, which is when we typically start working with them, they already have a lot of stigma built up, and misinformation, right? So things like, STIs just come out of the air, not realizing that one person has to get it in order to transmit it to another person, and that there are certain behaviors. When we talk about HIV, there's a lot of misinformation about how it's spread, right? People think, casual contact, kissing, hugging,
sharing the same glass.
Right, drinking out of the same glass, toilets, right, public toilets, or sharing a bathroom with someone. Like, all of this misinformation still exists. Even mosquitoes. I get that question almost every time I talk about HIV,
all the time.
right? And so really starting as soon as your kids start asking questions, you know,
It's to be honest.
about their bodies. Yeah, like being very honest and age appropriate. But you know what we need to do in order to get rid of the stigma and the misinformation is give accurate information, give it consistently throughout lives. You know, if we work with children, if we are parents or aunts or uncle, you know, like whatever it is, we really need to make sure that we're getting this information. And because there's a stigma about talking about anything to do with sexuality in this country, that translates into the prolific spread of misinformation. And so I believe that it is so important to start that from a young age and to consistently do it even through adulthood. I think all healthcare providers have this responsibility. I think all educators have this responsibility. You know, any time we have an opportunity to talk about, like, why do you think that it is gross or nasty or means someone's dirty if they have an STI, but you don't think it's gross or nasty or means someone's dirty if they have a cold or the flu, right? Like, think about how you are changing or how you have taken in this idea that somehow one is dirty and one is not. It's just about being human. This is how viruses and bacteria and germs spread. Like, this is just a part of the human experience. And so I really hope that everybody does that. I think, you know, PCPs should be out there talking to their patients. Pediatricians should be talking to their patients about these things and taking away the fear and the stigma from, you know, a very young age. That's my take.
Yeah, another barrier would be sometimes it can be a barrier for like at least the youth that I've like been around. Usually it's sometimes it's a parental advisory, if you get what I mean. I personally feel that, you know, children at a certain age, when they start asking questions, have a right to know what their body is going through. And some parents will, you know, deny their child, you know, access to the right education, sexual education, where, you know, it's, you know, they're getting what they need, but it's not, you know, pointed in the wrong direction, or it's not pushing them down the wrong path. It's not to make them go out and have sex. It's to make sure that they know what they're doing if they ever decide to do it, or if they want to wait. Like, it's about the conversation. It's about the conversation that you want to have. And a lot of parents won't have that type of conversation with their child until it's too late. The child has already, you know, had a number of experiences, depending on what it is, and you missed the chance to tell them, you know, so they could have been prepared for it. Like, I know if I was a parent, you know, my child grew up and he was already, or she was, or they were asking questions, and, you know, I'd already have my things prepared for them. Like, I would have, you know, condoms, you know, all types of preparations, you know, pamphlets. I'd have them, and, you know, I'd have them at Silk regularly, you know, things like that. But, you know.
Yeah. I know in other past sessions too, we've mentioned comprehensive sex education. So I know that is really important, and a lot of providers, it sounds like, you're really advocating for that. But just, you know, being aware of what's going on, what could happen, just so that you can make your own decisions and know where to get resources if you need them, right?
Right.
So I do want to remind participants, if you do have any questions, feel free to put them in the Q&A or the chat. And while you're typing them, I did want to ask if you all could talk a little bit about what it looks like to manage HIV if you are living with HIV. So what exactly does care look like?
Yeah, from, you know, at Allies, obviously we treat for HIV, and someone who is newly diagnosed can expect to come in initially once every 2 to 4 weeks. Obviously getting them on medications as soon as humanly possible. And then every 2 to 4 weeks. And that's in an effort to help them gain consistency with taking their medications, but we're also taking labs. We're tracking their cell counts. We're tracking their viral load, particularly early on, whenever if they are in the first stages of HIV, where that virus is replicating itself so rapidly. So every 2 to 4 weeks is really important for someone to come in for treatment. And then after the first few visits of a round of 2 to 4 weeks, depending on the situation, then folks are coming in every 3 to 6 months. Just depends, on the situation. But yeah, and medications can be mailed, to people's homes, so they're not necessarily needing to go to the pharmacy or come into Allies for their medications. Those medications can be mailed home, but particularly initially, coming in every 2 to 4 weeks is significant because we have to monitor those viral loads initially. And HIV treatment is just taking a crazy turn. It's such a crazy time to be alive for about a million different reasons. But if you think about HIV treatment in the 80s, where people are taking up to 40 pills a day, to now it's 1 or 2 pills a day, to now there's a shot that you can get in your arm, which is brand new. I know we just started offering it. I know Central Outreach is offering the injectable, but and that's it's so new that I apologize, it's new to me, but it's once a month or once every 3 months. If anybody else knows more about it.
I think it's once a month.
Once a month. Yeah, I mean, it's to go from like 40 pills a day to now you can get a shot in your arm once a month is just nuts to me. And having grown up in the 80s and kind of like watching this progression has been a really humbling experience.
Yeah, I agree with you, Alicia. I started in the mid 90s in this field, really, in HIV prevention. And it is just it's been such a wild thing to see how it's changed. It's wonderful. Also, there are a lot of programs in place that mean that people don't, that help to remove some of the barriers, right? Because cost, right? We all know medication costs are a huge barrier for people around the country. But the Ryan White Part B funding that comes from the government, that is it's a bit of a bureaucratic process as far as I understand, but there is money available and there are resources available helping with housing, with transportation, right? All of the barriers that we've kind of talked about. A lot of people can access those with some work and with some help from these great organizations, so that those things are not a barrier any longer. And so I just wanted to point that out because I think it is really, really critical that people are aware, because I think that can contribute to the fear of getting tested. Like, oh, I don't want to know because I can't deal with it. But there are a lot of resources out there to help people deal with it. Is that accurate, would you say, for care in terms of it being a bit of a bureaucratic process that you have to go through, but it is available to people who need it? Okay, good. I wanted to make sure.
Yeah, that's great.
I just saw this note in the chat that I'd love to read and answer because I love it.
I'm letting Christine field this one. I say it all the time. I have absolutely no shame in saying that Planned Parenthood does one of the best education programs for young people that I have seen. And anything that we do at Allies as far as outreach education for young people, I can promise you is like modeled after what Planned Parenthood's doing. So I'm going to let Christine have at this one. And Tyrell, feel free to jump in as well, because y'all are working with young people often. So
yeah, our demographic is 14 to 27. So we always just teach everything. I try to be as appropriate as possible. That way, no one feels uncomfortable or out of place. And like we just try to make it universal.
Yeah.
to where like even if you're older, to when you're, or even if you're younger, you can still grasp what what we're talking about, what your body can do.
Yeah. Well, and you said before, Tyrell, the sort of mantra that we have, which is meet people where they are, right? Like listen to them, understand what their questions are, and that's going to be your best bet for responding to them in an age appropriate way. I do have a couple of specific recommendations. As a parent, this is what I used and what I still think is like top of the line. There are some books, I think they're all available on Amazon, by Roby Harris. And it's a series that starts for like around 3 years old. I think that one is called It's Not the Stork. The second one is for, like younger elementary kids, like 4 or 5 up to about 9 or 10. And that one's called It's So Amazing. And the last one is called It's Perfectly Normal. And that's really for like 10 and up. That really addresses, it's aimed at young people who are about to start puberty or maybe have already started puberty. And these series are so great because they are really inclusive. They recognize that different people have different levels of comfort talking or thinking about these things, parents and kids alike. And so they have these little characters, one's a bird and one's a bee, and they sort of, one is really like sex positive and like, oh, this is so great. And the other one's like, oh, I don't know, I'm nervous about this. And it's super cute. So I highly recommend those. I will tell you that when we work with younger kids, really with any kids, we go by the National Sexuality Education Standards. And I can put a link to that in the chat as well. But the really cool thing is that it has been developed with a coalition of partners like SIECUS, Sexuality Information and Education Council of the US, Advocates for Youth. I can't remember who else. It's this group that they call themselves like Future of Sex Ed, but Answer, I think, out of Rutgers University. It's really this wonderful coalition, and they've gone through and like looked at all of the needs, from all of these experts about what young people need to know and when, and they've put that into an age and grade appropriate format so that people can understand what are the topics. There are some other great resources as well, and I'm happy to send those along. Maybe I could send them to Abby and she could send them out to everyone.
Definitely.
Okay, well, that would be great. And it's such a good question. It is really a difficult topic, but it's so important to give young people, the knowledge about their bodies and what's okay and consent. All of these pieces are like critical to developing healthy people. And that's what we all want. So. All right, off my soapbox. Sorry.
And we have a couple minutes left, so if there are any other questions, feel free to put them in the chat, send them through the Q&A. I guess the last question that I have for our panelists, really, unless another question comes through in the chat, is what can we as individuals and organizations really be doing to help destigmatize HIV and STIs? What can we do as individuals to help this process?
I think I'm going to talk right now without thinking, which is not always a good thing. But the first thing that wants to come out of my mouth is that language is really important. Yeah, that's one thing that we really try and focus on at Allies, as far as just the outreach education that we offer, how we communicate among ourselves. I mean, Allies, we're a staff of now 50 plus some employees. And we have to be really mindful of the conversations and the language that we use with one another as case managers, medical professionals, educators, even our administrative staff. We're very mindful of the fact that we're all using really inclusive language, scientifically factual information sharing, and challenging one another on our own comfort levels, just in talking about the subject of sex, and just, I think that's maybe a part of it too, is just kind of, when, if you're educating young people, kind of looking inside first to sort of check your own comfort level. But language is really, really important. Inclusive language, scientifically factual information sharing. I can't stress that enough. That's the first thing that came to my mind when you asked that question, Abby. Normalizing it. I mean, the proper language in order to normalize having sex. Everybody's doing it in some form or fashion.
Right. I would say just, as much as you can, just stay connected with other organizations and other companies. Like sending emails to each other, ideas and advice, and because I know I'm still learning. I've only been doing this maybe 6 years, and so I'm always here to learn, and I love learning, and I love like even be able to show someone else something, and that way, the umbrella can become a whole umbrella, and we all could be covering, the communities that need us.
Yeah, 100%. I also think we can encourage people to really learn about and support harm reduction programs. So things like needle exchange programs, so that people don't share needles, right? They can use a fresh, clean needle every single time. And yeah, just comprehensive sex ed, really just, I'm so with you, Alicia, that I think education is the key. Start early, do it often. Don't try to have one big talk with your kids. There should be
multiple conversations.
Right. A constant flow.
Help us stick in.
Yeah. 100%. And if you need help, reach out for help, because not everybody is comfortable talking about it. And what you don't say can communicate as much as what you do say. So if you need help, you can communicate that honestly with young people and say, I'm not comfortable, but let's find another person or another organization that is. You can get the information you need.
Right.
Well, thank you so much for being here. Thank you to our panelists. Thank you to our participants. Before you go, I do just want to plug that it is the week of World AIDS Day. So World AIDS Day is tomorrow, December 1st. I know there's a lot of events going on. There's a lot of testing events going on. I know the Allies Band is going to be at HSCC on Friday, 10 to 2. We're located in Turtle Creek, 519 Penn Avenue. I'll send this information out. But do you have any other events that are going on that you'd like to share as well?
Tomorrow.
No, go for it, Tyrone.
Tomorrow and we have two events actually. Tomorrow and Thursday. We're going to be doing a virtual karaoke night and album release party, and in lieu of World AIDS Day. The first night will be the album release for Project Stokes' very first music album. We have been taking some of our clients to a music studio to do music therapy and create music and create just stuff that is based around sexual and mental health. So a lot of our songs are based around that. I can send out the flyers through email. And then on Thursday we have another event on same virtual event. It'll be just a karaoke night. We'll be giving away prizes both nights actually. $50 gift cards. We'll be doing competitions, little competitions during the event. It should be really nice. We do the event is on an app called Bigo Live. A bunch of us youngsters, we just like to use them, I guess. We just like to use it. But yeah, I can send it out and then you guys can, if you are able to check it out.
Yeah, thanks.
Always does the most fun stuff.
Yeah.
We also are going to be in an event tonight. Sorry, I'm trying to multitask and share it in the chat. But it'll be at Trinity. Allies will be there too. So I don't know if you're there, but it's at Trinity Lutheran Church on the North Shore, where they'll be doing in-person testing. We'll be giving out at-home test kits. They'll be doing vaccine. I mean, just about everything. And there's the flyer. Hopefully that works.
Food.
It's going to be soon. Is that what you
I
said?
said there's going to be food.
Oh, yes. Food. Yes. And that's from 6 to 8 p.m. tonight. And that's the flyer right there.
Yeah, and that's with Shepherd Wellness and Macedonia Face as well. And then tomorrow, Allies is hosting an event in the parking lot of the Giant Eagle over in East Liberty, where we have quite a few partners joining us who are going to be tabling. You know, again, we'll have free testing, some folks sharing stories, you know, stop by for some snacks and
Yeah.
light jam.
Good, healthy stuff.
What time is that tomorrow, Alicia?
That's, I think it's 1 to 5.
1 to 5?
Yeah.
Well, that is our time. Thank you for sharing that. Thank you for sharing all of your knowledge and the resources with us today as well. I will be sending out a follow-up email. So if you do have any questions, you can shoot them my way back through that email, and I can get you connected with resources as well if you're looking for them. Thank you so much, everyone, for being here today, and have a great rest of your day.
You too.
You
Bye.
as well.
Thanks for having us.
Good to see you guys. Thank you for having me.
You too.
Take care. Thanks, everyone.
Bye.
Thank you.
Bye.